Clifford M. Levy, MD, orthopedic surgery, and what I do is spine surgery. My undergraduate education was at Bowdoin College in Brunswick, Maine, which was a very nice place to be in the late 70s and early 80s. Following that, I was in New York City for medical school at Mount Sinai Medical School, which is now called the Icahn School of Medicine. Following that, I spent a year at the University of Pittsburgh in Pittsburgh, Pennsylvania, doing spine surgery with two very, very talented spine surgeons. And again, it was a wonderful training experience that I think prepared me very much to start practice in New Hampshire as an orthopedic surgeon. From a young age, I decided that medicine was an area that interested me. I was intrigued by the idea of being able to help people. The thought crossed my mind maybe in 4th grade, but certainly by 6th grade, I became interested in it. I had an uncle who had a severe heart attack when I was in 6th grade, which he subsequently passed away from. And I thought that the potential for the doctors to be able to cure and help people was a fantastic opportunity to be able to pursue. The most interesting aspect of my subspecialty is probably the variation of problems that I see within the world of spine surgery. Although there may be an assumption in the public that it's only a couple things that we do, there's actually a variety of different problems that we see, and that variety, whether it's people in their 20s and 30s, 50s and 60s, or 70s and 80s, is probably the thing that I find the most interesting. Doctor-patient relationships are things that take some time to develop. Initially, I think there needs to be a bit of a leap of faith by the patient that this individual, being the doctor, can help them with the problem that they're seeing. And once that's done, I would say it's a trust that the patient will hopefully be able to follow the instructions and have a problem that we can successfully treat, and a trust on the part of the patient to us that we're going to show up every day to do the very best we can to treat and try to cure the problem that they're suffering with. In terms of rewarding, I think probably what makes the job rewarding is the ability to help people when they've had an acute change in their life, when all of a sudden something happens and their life has been turned upside down, and anything you can do to try to alleviate that aspect of their suffering in terms of relieving pain and having them try to be able to move forward, I guess would be the answer to that one. Staying up to date today is easier than ever. There's meetings which have existed for a long time, there's journals which have existed for a long time, but now there's computers. And although I think computers in medicine have had a real negative effect in terms of loss of eye contact and direct contact with a patient, at times in the office for an office visit, they allow for, that part you can edit out. Computers allow for us to stay up to date in an easier way than ever. There's more information that's readily available from responsible sources. There's video, there's reading, there's lectures. Keeping up to date can be done from the comfort of your own home, and I don't think has ever been easier since I started medical school in 1982. My interests outside of medicine are my family, which I'm very proud of, and maintain relationships with them as they grow and go through life has been the focus that I've had. I'm a family person.